One's going to stay in the background, but just.
Okay. Perfect. Well, we are flipped over here now. Great. Well, I think we may have a few more folks who do hop in and join us today. So we may see them start to filter in. But today we have with us Dr. John Weiner, who's at Duke. This sort of became part of a series of webinars that we've been doing in this broader topic area. So we really appreciate you joining us again today for round 2. And I think we can go ahead and just kick it off to you, Dr. Weiner.
Okay, thank you, Christy. My name is John Weiner. I am a urologist who mostly focuses on children, but I take care of patients with spina bifida of all ages, from newborn to people in their 60s. I helped write the Men's Health Guidelines for the Spina Bifida Association, men's health meaning basically sexual function. I guess in this day and age, I should specify I identify as he and him. And just so you know, I'm been married to my wife for 27 years, and I have 2 daughters and a son, and they're all in their 20s. So I have lived through life as a parent of teenagers. I became interested in addressing sexual problems of adolescents and adults with spina bifida because here at Duke we take care of patients of all ages. Some children's hospitals will send people out when they become 18 or 21 or 25, and I take care of patients of all ages. And I realize how important sexual health is to the overall physical and mental health of all individuals. That's part of why I went into urology. I like talking about sex. I think it's an important part of life and something that everyone should be able to enjoy if they want to. We want to keep it safe. We know from scientific studies that people with spina bifida are often left out when it comes to talking about sexual development and sexual health, and their knowledge is often behind that of their peers. A lot of people think that because someone is handicapped and has disabilities that they can't have sex or have sexual thoughts, and we know that's not true. We started this session to allow y'all to get more information. Now we're talking about sex today. It should be fun. I don't have a PowerPoint presentation. I am sitting here in my office, but let's make it fun. So if everybody is on Zoom, you see the Q&A thing down at the bottom. Let's do it like we were all in the same room together. But this is nice because it gives people privacy. So, first thing we're talking about is penises. My last name's Wiener. So, it's a joke I've heard for years. My dad was also a urologist. Let's throw out some names. Type in names for penises. What people call them. We don't want to make it too scientific and just use medical terms. So, type out some some names of what people call penises. All right, Willie. Yeah, I have a cousin named Willie Wiener, and that he gets a double wham there. Anybody else? My colleague at UNC who does a urology at Spina Bifida Clinic, his name is Richard, but he likes to go by Dick. Oh, come on, don't be shy. Okay, well, let's talk about penises for a little bit, or willies or wieners, or so the nerves that give sensation to the penis, so that you can feel somebody touching it, come off the lower spinal cord. So men with spina bifida may have decreased sensation in their penis. Again, those nerves could be affected by the spina bifida, and so the higher level somebody has of spina bifida, the greater chance that they may have reduced sensation in their penis. So that people with spina bifida whose legs aren't affected much, who walk around, most of them have normal sensation in their penis. People with higher levels of spina bifida may not have normal sensation in their penis. That's important because the sensation in the penis helps with getting erections when the penis gets hard. Usually beginning as one goes through puberty, the penis gets, the penis grows and has erections pretty regularly to help it grow. Erections mean that there's a lot of blood flowing to the penis, and that helps it grow. So every teenage boy pretty much has problems with erections happening when they don't want them to happen, when you're at school and things like that. But that helps the penis grow. But the penis getting hard and erect may be affected if the nerves don't work properly. I'm going to stop there, and I don't want to sit here and lecture the whole time. I'd like people to ask questions. So please feel free to ask questions. Just type them in, and I won't announce anybody's name or anything. I will just do that. When I met with parents a few weeks ago, basically I just answered questions for 90 minutes.
And I will add too that as you are typing in any questions to that Q&A box at the bottom of the screen, there is an option to submit them anonymously. So feel free to do that if that's more comfortable. But this is intended to be helpful for all of our participants. So just want to make sure that whatever questions you guys have, you feel like you have a space where you can ask them.
Thank you, Christy. Okay, well, let's I'm going to go to another topic. Testicles, they are balls. Give me some names for those. What people might call testicles or balls. Nads, yep, nads is a short name for gonads. Gonads refer to the reproductive organs, being the testicles in men and the ovaries in women. All right, someone's asking, can you talk about how you ask young men with spina bifida about their sexuality and whether or not they get erections? Good question. So usually when I think a boy is beginning puberty, so like teenagers, then I will, and usually the mother, sometimes the father are in the room, and I'll ask questions about their bladder and urinary tract and kidneys and those things. And then I will say, well, I need to examine you. Let's let your parent step out of the room. And that way I can get the parent out of the room, and then we'll talk about it. And I'll ask about, first of all, just ask about erections. You know, does your penis get hard? Does it stay hard? And then offer to ask about what questions do you have? Sometimes that's with the parent. Some of those discussions are with the parent, depends on the family and how, because for most of my patients, I've known them their whole lives. So I've known the parents their whole lives, and I have a sense of which patients need more privacy than others. But privacy is important. I certainly wouldn't have been comfortable talking about these things with my parents in the room. So I try to allow my patients to have the same. And then when I talk about erections, we discuss it. Again, I try to get a sense of how long the erection lasts, because some patients with spina bifida can get erections, but particularly with decreased sensation in their penis, may have trouble keeping the erection. And we have treatments for that if that's a problem. Often I don't write prescriptions for that till patients are 18, but that's, again, something we can discuss in private. And then we may talk about ejaculation and those things, depending on how interested the patient is and how mature they are. So I hope that answers that question. Next question, are there specific considerations men with spina bifida need to be mindful of related to their penis and gonad care if they are a full-time wheelchair user? Again, I think a lot of it has to do with sensation. Just like people who are in a wheelchair, if they have decreased sensation in their skin on their backside, then they may not feel sores develop and pressure ulcers. So I've had a few patients have some skin ulcers on their penis or scrotum, ball sack, whatever you want to call it, related to that, but that's pretty rare because usually it moves out of the way and there's no pressure on it. Have had a few patients who may have a leg brace that goes up all the way up their thigh, and that could put some pressure on the penis. So first thing is just good health. Look at your skin every day there. Obviously it's easier to see your penis and testicles and scrotum than you can your backside. But just looking at that for good health. If you're not circumcised, you should be pulling your foreskin back every time you bathe, just to make sure it looks healthy and keep it clean. That'll cut down on infections. But I think that's sort of it in terms of special care for a wheelchair user. I will take this time to talk about potential for abuse. Obviously, things should be, sexuality should be safe and something you desire. And if you don't desire it, then you should be able to say no and a person respect your wishes. For patients with spina bifida, it can be different because some of the boundaries are broken. If you need to be catheterized and you can't catheterize yourself to empty your bladder, then someone else has to do it. There are not many other disease processes where strangers are touching the penis in boys or the vagina and urethra in girls. So patients with spina bifida have a higher risk for for abuse. And so you need to realize these are your private areas, and no one should touch it without your permission. But sometimes other people do need to touch it to give you proper health care. Next question, should we expect to see erections in prepubescent children, meaning before puberty? And if so, does that possibly predict future erectile function? So should we see erections in children before puberty? So most males get erections during sleep. It happens during the stage of sleep called REM sleep. And so that's very normal. And it's normal to wake up with erections for a lot of guys. And that's because you're just waking up in that phase of sleep when it's normal to have erections. So if you're not having erections during sleep as an adult, that usually means that you don't have normal normal erectile function. There was a study done about 25 years ago by actually doctors at Duke and UNC. It's the only one of its kind where they actually put these monitors on the penis to detect erections during sleep. And it was in about 20 men with spina bifida, and a lot of them did not have normal erections during sleep. Some had none at all. Some had them, but they didn't last the normal amount of time, and then some did have normal erections. Before puberty, some boys have erections regularly, some don't. Puberty happens because the testicles start making testosterone, which increases erections, not only to make the penis grow, but just men who don't make testosterone have fewer erections. So some kids before puberty don't have erections. That doesn't mean they won't have erections as adults, but if you have good erections before puberty, then you're probably going to have good erections after puberty. Question, advice for a mom with a toddler with spina bifida growing up with 3 typical older brothers. I think this isn't just about sexuality. I think for parents of children with spina bifida, they need to treat them just like their other children, and have the same expectations, you know, that they're going to graduate from high school, hopefully. They may go off to college, or they're going to get a job. They're going to live on their own. I think that the problems I see in some adults is their parents don't aim high enough for them. And the expectation is that they should be able to do most of the things that their siblings can do. And so whether that's educational or vocational, getting a job, or sexual relationships, the expectations should be similar. And so, you know, they should be treated just like able-bodied siblings. You know, if you get into conversations, you know, just the child with spina bifida may not be able to walk or run like their siblings, but they can do a lot of other things. And they also, if people ask, their sexual function may be different, but working with doctors, we can help with that. Just like working with doctors, we can help people get around better or have better bladder function or bowel function. Next question. I'm interested in how you talk or counsel a teenage boy with spina bifida who does have decreased sensation in his penis and cannot hold an erection and would like to be sexually active. Let's say the boy is 15 or 16. So some of the research that's been done is beginning to point to the fact that decreased sensation may make it hard to keep an erection. And I think it helps me understand how erections work in able-bodied men. So a lot of patients with spina bifida, the majority, can get erections thinking about sex. So when you're with somebody who turns you on in an intimate situation, or watching things or reading things about sex, that you get an erection, you get hard. That's called psychogenic erections, meaning that what's going on up here is turning you on down there. And a lot of patients with spina bifida do get that. It may be hard for them to keep an erection because without someone touching it, it's hard to maintain it. I think that's probably true for all men, whether they have spina bifida or not. But when you have normal sensation there, that's enough. If you have decreased sensation, then that may be a problem. But there are medications that often help. Most of you probably heard of Viagra and other drugs like Cialis and Levitra. Those medications work pretty well in men with spina bifida. And so I prescribe that for some of my patients with spina bifida. And you just have to figure out what dose works. So I would say to the 15-year-old who is interested in being sexually active, that may, we have treatments that work for the majority of patients. I can't say it works for everybody, but it works for the majority. And then in terms of prescribing it, a little complicated with the prescribing medications for minors. But that's a discussion that probably have to involve the parents in, because they're going to be the ones purchasing it. That's not necessarily true. So I think you have to individualize for each patient in each situation. Are matters of privacy taken into consideration when considering a Mitrofanov belly button cathing surgery? Don't have to touch the penis to catheterize. I did 2 of those this week, one in a 12-year-old girl and one in a 12-year-old boy. Sure, that is taken into consideration, but probably the sexual part is not as important in my way of thinking, but it's not something I ignore either. It's particularly important for girls because boys have a lot easier time catheterizing themselves because they can find their penis and hold it and find the opening to stick the catheter in. For girls, that opening's on the inside, and a lot of them cannot be catheterized unless they're laying down. So they have to get out of their wheelchair. And so even not thinking about the privacy part, just the independence part, that I had patients who could never be away from their parents because they couldn't be catheterized. And so the Mitrofanov procedure, where we often take the appendix and stick one end in the bladder, or one end in the skin, often at the belly button, and one end in the bladder in a way that it doesn't leak, and you can put a catheter in through your belly button or off to the side. Now, sometimes for patients that are incontinent of urine because their bladder neck muscles are extremely weak, we may tighten that down with surgery, and then we've tightened it down so much that you can't get a catheter in from below. So in doing that, it's not possible to catheterize through the penis anymore, and so they need a Mitrofanov to catheterize from above. To do it purely for reasons of privacy, that'd be a long discussion, just because it's a big operation with risk, and there can be complications. People can require additional surgery because the hole in the skin can scar down and make it difficult to catheterize. People can injure the channel and require additional surgery. So it's not something to be taken lightly because it's a big operation. But I would say that privacy is something that is taken into consideration. Next question. How do you communicate to youth that their private parts are private? When most of their lives, for medical professionals and parents, have touched these private parts for legitimate reasons without a second thought to prevent abuse? Great question. Again, safety's paramount whenever we talk about these things. And again, as I've talked about, many patients with spina bifida who are catheterized, that barrier is often broken routinely. And from information from the National Spina Bifida Patient Registry, we know that 75% of patients who participate in the registry who are teenagers or adults catheterize their bladder. So we're talking about 3/4 of spina bifida patients. You know, I think some of it is just the same conversations with any child that the parts hidden by your bathing suit are places that are private and other people shouldn't be looking at. And that's, you find that in any, in most books on sex education. And then in terms of, you know, the difference for patients who are catheterized, I often say to patients as I examine them, you know, I'm a doctor and your parent is here, and it's okay because I'm a doctor and your parent is here. Again, both in that situation, because there are some people who might say they're doctors without the parents present. But again, patients who are catheterized by others at school or at camp or something, we talk about that and say, you know, because you have spina bifida, your bladder is handicapped and you need to have a catheter to empty your bladder. But be sure that that the individual is just doing that and putting the catheter in, getting the urine out and taking it out. And then after that, your pants are back on and no more, if it's taking longer than it should, or you don't feel comfortable, then say no. And it's much easier today with cell phones because you can call for help if you're uncomfortable. That's it for questions right now, but let's bring some more in if you've got them. Let me, question we get often is, you know, I have spina bifida, can I have children? The answer for girls is almost always yes, because the nervous system isn't very important for women to get pregnant. For men, it is very important. Again, you need some nerve function in the penis to get erections. You can't have sex, meaning, well, let me change that. You can't have intercourse, meaning putting the penis in a vagina and to have intercourse to get someone pregnant. So you need to be able to have erections. And then to ejaculate for semen or cum to come out, there needs to be nerves to help that leave the seminal vesicles, the prostate glands, those are sexual organs on the inside, and then enter the urethra where the urine comes out or the catheter goes, and then shoot that out, that's called ejaculation, into the vagina. So those, so you need some nerve function for that to happen. For patients that don't have that, sometimes there are ways to get that to happen that doctors can do. One is called electroejaculation, where there's electrical stimulation, and sometimes that can cause semen to come out. Or in more complicated situations, they can do a biopsy of the testicle and take sperm from that, and that can be injected into the egg, called test tube baby or artificial insemination or in vitro fertilization, and that can be done to help an egg and a sperm get together and make a baby. So sometimes it requires, these are called advanced reproductive techniques. Sometimes that's required to help patients with spina bifida have children. And I have a friend with spina bifida who's got 2 beautiful children, and they had to use some of those techniques, but he's got 2 beautiful children. I've got other patients with spina bifida who didn't require any of that and have children. Now, does spina bifida increase the odds of being sterile or infertile? Yes. Again, as we're beginning to learn, some men with spina bifida, or some boys, their testicles don't descend properly and need to have surgery for that, and that can put them at risk. And some, just the testicles don't develop well. We don't understand why. We're beginning to learn more about it. And reviewing articles about men with spinal cord injuries, so these are people who were not disabled and then became disabled. The earlier they're disabled, particularly before puberty, the greater their chances of being sterile or infertile. So there may need to be some nerve input to the testicles that we don't really understand yet that may be important. So some men with spina bifida have small testicles. They just don't develop well. And since most of the bulk of the testicle is the sperm making machinery, if your testicles are small, then your testicles may not be making sperm well. The only way to tell would be do a semen sample, so that if you do ejaculate, you collect that, and then we look at it under the microscope. I have a patient in his 30s who had that done recently, and there was no sperm seen there. So the next step is to do a biopsy of his testicle and see if there are sperm being made in the testicle. And if so, those can be taken, frozen, and then injected in an egg of your partner when so desired. There are going to be some that aren't making sperm properly, and so there are some men with spina bifida that won't be able to have children, but we think that's a minority. And while I'm talking about that, you know, if you have children, if you have spina bifida and you have children with, are those children at an increased risk of spina bifida? The answer is yes, but not all that much. The thought is it's about 1 in 20, or about 5% chance. Those studies were done before we understood a lot about how folic acid or folate in the diet is important in preventing spina bifida. We think that there are low folic acid levels in babies very early in development, when they're embryos, that may cause spina bifida in about 3/4 of cases. Some of that is because the mother isn't eating enough folate or folic acid, or there could be genetic reasons why the enzymes in the patient's body doesn't process that vitamin properly. That explains why in some families there is a inherited risk of spina bifida, and in other families, some ethnic groups have a higher risk of spina bifida than others. But today, with folic acid is added to flour and corn masa to make tortillas, so that the whole American population should be getting more folic acid than they were 20 years ago. And so hopefully that will reduce the risk of spina bifida across the United States and across the world where this is done. But for patients with spina bifida, we recommend that the female partner take increased levels of folic acid before getting pregnant to try to prevent spina bifida. Again, send in your questions. Let's talk a little bit about ejaculation. Again, the semen is made from the sperm from the testicles. That's only about 5% of it. Most of the fluid in semen comes from the seminal vesicles, which sit behind the bladder, or the prostate gland, which sits below the bladder. And in able-bodied men, when a man reaches climax or orgasm, those fluids enter the urethra and then get propelled by muscles to shoot out the penis. That's called ejaculation. And that's to shoot the sperm and the fluid and the semen into the vagina to get a woman pregnant. Those mechanisms may not work properly. One thing that's supposed to happen when that occurs is the bladder neck's supposed to close. So that fluid enters below the bladder neck and the bladder neck closes so it shoots forward. If the bladder neck doesn't close properly, the fluid may go up into the bladder. That doesn't hurt anything, and some patients with spina bifida may notice that after sexual activity, their urine may be more cloudy. That's just semen in there. It doesn't hurt anything. It just means it's going backwards rather than forward, but it's not harmful. For patients that have that, the urine can be taken, put in a centrifuge to spin it down, and then the sperm can be collected out of the urine. Once it does, if it's going forward, but the muscles aren't there to shoot it out, a lot of patients with spina bifida notice that it just sort of trickles out rather than shoots out. And again, in terms of if you want to have children, you just need to adjust your sexual practices a little different to account for that. Again, that's not harmful, and it doesn't necessarily mean you can't have children. It's just like a lot of things with spina bifida, you have to do things a little differently. But with time and practice, you can overcome a lot of barriers. Some patients with spina bifida may not experience orgasm or climax the same way. Again, that has to do with sensory nerves. But that doesn't mean that sexual activity can't be enjoyable. It just may be a little different. I think it's important to understand that sex is not just about intercourse. It's about intimate relationships and touching with your partner. You know, if that person cares about you, then they're going to understand that you have differences. All humans have differences in lots of ways, and you need to find someone who's accepting of your differences. But every human is unique, and hopefully there's somebody they can find to make them feel special. But it may require more talk of saying, you know, I've got spina bifida and my junk works a little differently. But I think if that person cares about you, then they'll understand and learn how to give you respect and love. A lot of parents, you know, will ask, you know, when should we start these discussions? And that's just like everybody. Certain boys mature at different rates, and so some people are more open to these discussions than others. Some of that comes from how these things were discussed when you were growing up. But again, I think when I see teenagers with spina bifida, I try to ask a few questions just to start opening up a conversation of like, did you know that you may be able to have children? Or for the girls, that there's an excellent chance you'll be able to have children. You need to be careful. And actually, let's talk about being careful. Sexual activity can be wonderful, but it also can be dangerous. For one thing, if you don't want to have children and you're a guy having sexual intercourse with a female, obviously you may be able to get that person pregnant. Just because you have spina bifida doesn't mean you may not be fertile. So you need to take precautions. If you don't want that person to get pregnant, then you need to practice birth control. One of the best methods is using condoms, because condoms also prevent another problem, and that's sexually transmitted diseases or venereal disease. Things like gonorrhea, syphilis, chlamydia, herpes. So condoms protect against most infections, and not perfect, but also can prevent unwanted pregnancies. One thing it's important to know is another name for condoms is rubbers. Most condoms are made out of rubber, latex. And most people with spina bifida should avoid contact with latex, because spina bifida has one of the highest instances of latex allergy of any disease process. But it's important for you to know that there are non-latex condoms. When I go to the drugstore or grocery store and I find myself on the health aisle, I'll sometimes just look to see if they've got them, and most stores have them. You just need to look for non-latex. A lot of them are made of polyisoprene. That's the same material we use for our gloves in the operating room. One brand is called Skin, S-K-Y-N. Instead of S-K-I-N, it's S-K-Y-N. That was just easy to remember. Important to know that there are non-latex condoms. And again, they can protect against disease, most importantly. And that's whether you're, if you're having sexual contact with anyone, and then again, they can protect against pregnancy with females. Be happy to take any other questions. I think that's about covered the most important points. Unless people have other questions, I don't have a whole lot else to say. I don't want to have this drag on too long. Here's a question. We've read about restoring penis sensation via surgery. Great question. I was talking to a young man about this for a while yesterday. So there are operations where you can take a nerve that isn't working and take a nerve from somewhere else that does work and sew it to that nerve that doesn't work and gain sensation. So at the top of the penis are two nerves called the pudendal nerves that supply a lot of the sensation. And so there's an operation that was designed by two guys in the Netherlands named Max and Thomas, and it's called the Tomax procedure. And it's Tomaximize something, but it's really a combination of their names, Thomas and Max, where they cut what's called the ilioinguinal nerve and sew it to the pudendal nerve. The ilioinguinal nerve provides sensation to the scrotum and to the inner thigh. So if you have sensation there, then there's an operation that can be done to move that nerve. I only know of one center in the United States that's doing that. That's in Seattle. I don't want to offer that here yet, because I've seen operations that have been touted as being wonderful and having great success, and it turns out that they don't always work. So I'd like to see more evidence before I start offering that surgery. But I've talked to my colleague in Seattle, and he's willing to see patients. It is a long way away, but again, I want more long-term proof before cutting nerves and sewing them to others. But it is possible, and that operation has a pretty high success rate if there is good sensation where the ilioinguinal nerve goes. There's a question that's more detailed, but I have the AMS 800. The AMS 800 is called an artificial urinary sphincter for some men with spina bifida and men with other causes of urinary leakage. There's a device that can be put around the urethra that squeezes down to keep urine from leaking, and then there's a pump in the scrotum, almost like a third testicle, that is pumped, and that opens up so that the patient can urinate. That's in able-bodied people, and patients with spina bifida, they still may need to catheterize. It's not right for all patients with spina bifida, so don't go out and say, I need an AMS 800 because I heard about it that it's going to make me dry. In the right patient, it can be very effective, but not for everybody with spina bifida. And you can talk to your urologist about that. So the question is, I heard that it prevents cum from ejecting. Also, my AMS keeps me pretty well incontinent free, but I do leak. I'm afraid I might urinate during intercourse. Okay, so several things there. For able-bodied men, and some men with spina bifida who can walk, who have an AMS 800, they tell me that they can ejaculate through it. If there's enough force, it will push the semen or cum out through the artificial urinary sphincter without having to open it manually. So that should not be a problem. If your semen doesn't shoot out but trickles out, then that may be a different matter. Now, the question is, I'm afraid I might urinate during intercourse. So does the AMS 800 artificial urinary sphincter make everybody 100% dry all of the time? No. If you're active enough and exerting abdominal pressure, that's going to push on the bladder and it may push some urine out. So some of my patients with spina bifida who have one tell me when I lift weights and I'm straining to lift the weight, that's pushing on my bladder and it may push a little urine out. Usually not a lot, but a little bit. Patients that play golf sometimes say, you know, when they swing the driver really hard, they leak a little bit, but not when you're hitting a putter because you're not using as much force. So sometimes increased pressure will force a little urine out. So what can you do about that if that happens during intercourse? Well, I think the smart thing to do would be to go empty your bladder before getting in a sexual encounter. That may take a little spontaneity away, but often for a variety of reasons, people say, give me a second, and before proceeding further with sexual relationships. So if you have an empty bladder, then it's going to be pretty hard to leak. If your semen doesn't shoot out but trickles out, I guess still you could, after you have an orgasm or come, you could open the sphincter and the semen would come out. You would just want to have an empty bladder before doing that. Again, that was pretty specific for a specific problem, but good to discuss it. Another question, you talked about lumbar level. In your experience, say in general that patients who are ambulating and have a low lumbar level are more likely to be able to hold erections. Or what lumbar level would you say is unlikely that a patient will be able to hold erections? Can you recommend any good literature about this topic for medical professionals? And do you have literature or books that you recommend for parents or patients? A couple of things. One, with my friend, Dr. Hadley Wood and Dr. Dominic Frimberger from the Cleveland Clinic and University of Oklahoma, we wrote the Spina Bifida Men's Health Guidelines. So that is a good starting source. And if you're a medical professional, we then wrote a follow-up article in the journal Urology, which covers all the literature that we use to come up with the guidelines. And so that's a good introduction to the topic for a medical professional and highlights a lot of the articles. There's one article from Italy. I believe the author was Gatti, G-A-T-T-I. I think they were from Parma, Italy. And they did a study showing that patients whose level was, I don't remember exactly if it was below L3 or L3 or below, those patients, the majority had good erections, and those that were beginning at L3 or L2, again, I don't remember exactly which level it was 2 or 3, had a much lower risk. So it's around L2, L3. A lot of the erection, the nerves for erection, as well as the sphincter working, are in the sacral levels at levels 2 and 3 and 4. But again, the level of spina bifida doesn't always correlate with nerve function. So that's why somebody with an L5 level may have decent sphincter function in S2 and 3. So everybody's different, and you can't just base it on where their scar is. And another project I'm working on now is, and we had a conference on this to start this process with the SBA a year ago, is to try to make some videos so that people can watch this in the privacy of their own home, can watch it with loved ones or with parents to understand this. And we're just starting to write the scripts for the initial ones, talking just basically for school-age kids to talk about their private parts, and then to talk about puberty. But we had several individuals who are adults living with spina bifida to tell us about their experiences, and over time we plan to create videos and for patients of all ages with spina bifida to learn more about sexual function. Now, some of that will have to be a little more private, so that we don't have 8-year-olds seeing videos that are meant for adults, but that's our plan. Any other questions? I see it's now about 55 after, and we had scheduled this for about an hour. So I hope this has been informative and fun for you. It's a little weird looking at my computer monitor and not looking at audience to know if if this is well received or not. Again, thanks for your time, your interest, most importantly, your questions. It's been fun, and I hope you found it informative. Christy, has this been recorded?
Yes, this has been recorded. So the link will be sent to you to anybody who registered. Mm-hmm. So if anybody has additional questions or wanted to kind of go back and see how you had answered a particular question, that will be available too. So great. Thanks very much for your time today, Dr. Weiner, and to everybody who joined us and submitted your questions. So thank you.
Yep, thanks for making it interactive. It's a lot more fun for me to answer questions than drone on things that may not be interesting to people. So for everybody sure. Stay safe, and hope everybody is careful and loved. So long.
Sounds good. Thanks, everybody. Bye-bye.